Good morning everyone, this is Sujayashree from Medula Talk Show, and I would like to thank sir for giving us this time.
Thank you.
And we are very honored to have you here, sir.
Same here.
Sir, how do you feel coming back as a chief guest after you've done your post-graduation here, sir?
I feel honored. I feel elated to be in the same college. Like, I still feel when I was roaming around, I was feeling like it was just yesterday. I was here. I was born and brought up here. Before coming here, I was talking to my wife. Like before coming to college, when I landed at the airport, I was talking to my wife, and I was like, "I'm back to my Karambhumi."
What made you choose radiology, sir? Is there any story behind choosing this as your profession? And has the profession lived up to your expectations?
Yes, profession has definitely exceeded my expectations. No issues about that. Radiology, coming to radiology, at the moment in my final year maybe I was more into ortho. But I was more into gadgets and all. And back at my place there was severe shortage of radiology services. People were there, but they were not up to the mark. They were not doing good reporting. They were using old machines. So I was like, I have to give back to my home place. So that was the branch I chose.
What inspired you to start 7 centers of PET scan, sir? Were there any setbacks you faced during your establishment of career?
7 centers, yeah, lots of setbacks. Basically, I just wanted to, excel more. I just wanted, if I have done something good at my home place, Punjab, Gurdaspur, so I wanted to give my services to other cities also. So I'll tell you one example. So on the nearby town, not a town, nearby city, they had around 5 or 6 centers, radiology centers, but all of them same as in Gurdaspur. They were using old machines, 0.3 Tesla machines and all. So I introduced latest technology there. So once you start up a center with new techniques, you get public response, you get good response from the doctors, you feel like opening more, going to more cities.
Most in demand, and they say it's less stressful than other fields. Is this really true, sir?
No, not at all. You ask me how stressful radiology is. The thing is, if you want just a job 9 to 5, you just go to a center, work there from 9 to 5, then it is no stress is there. It's the same with other branches also. If you just go and work and come back, there is no stress. No stress in ortho, there is no stress in surgery, there is no stress in medicine. But if you want to excel, you want to put your own center, then you have to give time.
So can you enlighten us on what the day-to-day life of a radiologist actually looks like?
Depends again. For me, it is too hectic. I'll say 6 days a week I'm not able to have lunch. I don't have time. I miss my meals. Multiple health problems have come up, like obesity. I've gained a lot of weight just because of irregular eating habits. Your patients will an ultrasound. The ultrasounds the patients will have to make their urine pressure and all. So you can't leave them and go for a lunch. So if you just come out of your clinic or come out of your room, go to your retiring room, the patients start shouting. So this is India. They can't understand it. So life is quite hectic in radiology also. Night cases, I have to report all my centers, CTs, emergency CTs I have to report. So multiple times I have to get up. So it is hectic.
Then how do you reassure a patient who is having the first time they are taking their CT? How do you reassure them, sir?
It's not a big deal doing this. The patient is having I don't go to the patients who are having CTs and all. The thing is, the technician will do a CT. All the pressure on me is to report it early. So that pressure I have to take. I have to see the report goes good. There's no error in the report. There's no typing error, and I have to report it immediately.
How do you deal with the burnout, sir? How do you find balance between your family and your work life?
Burnout, I come home to my beautiful wife and a handsome son. So that elates me, my mood. I come out of my burnout. I feel happy there. It's my happy moment, or you'll say the most cherished moment of the day is when I come home back. And regarding the next question was the burnout, and the second part was
balance between.
there is no balance. Multiple times I have to face the wrath of my wife because of no balance. It's difficult to manage. It's like again the same thing. If it is just a single center 9 to 5 job, then it's easy to manage. It's quite easy thing to balance. But multiple centers, I have to travel a lot. I have to go to each and every center. Like it will be maybe once a month or maybe once in a fortnight, or whenever I deem necessary, I have to travel. So balance is a bit difficult.
Have you noticed any conflict between radiology and surgeons?
Multiple times. I'll say always. I'll say always. You will write, I'll give you an example. Simple cholecystitis. So you will give the size of the stones, you will give the size of CBD, and suddenly the surgeon will call, okay, you have just written the gallbladder thickness is normal, but I don't want to know what thickness exactly is. How does it matter if I have written it normal, thickness is normal, it's 2-3, but how does it matter if it is 2 or it is 2.2 or what? Sometimes the surgeon also expects more, and sometimes even the radiologist might miss it. But the major thing which comes up is with the gynecologist. Many times they'll ask irrelevant questions. How long is the cord? How tight is the cord? And I'll tell you an instance. I got a call from one of the gynecologists back home. I gave fetal ascites. So I got a call from the gynecologist and she was like, sir, fetal ascites, isme hawa hai ke pani hai? So I was altogether shocked. Okay. So things come up.
Can you share any case that changed your perspective about radiology?
Yeah, definitely. I was the first center in the region, and I won't call the city, in the region. Maybe 2 or 3 centers are there in Punjab who are doing perfusion scans. So I got a case, left-sided hemiplegia, recently started, one of my neighbors itself. So when the hemiplegia started, they came up. So I did for a CT, basically they came up for a CT. So I did a CT and CT was perfectly normal. It was maximum 15 minutes down the line the patient came to my center. The CT was normal. So I convinced them, I asked them to get a perfusion scan done. So on perfusion scan, there was total MC tetrary infarct, a big infarct. So we got it detected in 15 to 20 minutes. The patient was well treated and the patient was normal within a week or 10 days. If it was left, the damage would have been more. So that changed a lot of things.
What changes do you think should be made in medical curriculum which will ensure that students can become more competent enough to run a clinic after passing?
This thing, when I was talking to a chairman sir also, I was discussing the same thing. When I joined the college, chairman sir told, like, the first thing he told me was, I want my PGs to go out as consultants, not as SRs. I want them to train practically, not just theoretically. So if we bring more practically oriented curriculum, that will be better. The doctors will be more competent rather than theoretically oriented.
What is your most treasured memory of being a radiologist, sir?
Most treasured, I'll say seeing my son in 3D.
What, according to you, is the most important thing a clinician must keep in mind while treating a patient?
To treat the patient as a whole, to be more compassionate towards the patient, and treating him on the whole, not just like, okay, the patient came for a simple scan, that is it, not like that. The patient is not as a human body, patient should be treated as a whole, as a human being, not a body.
Where do you see yourself in 10 years, sir?
10 years is quite far. I'm not decided anything, but yes, nowadays, like presently, we are covering almost half of Punjab. Maybe by 10 years, we'll cover whole of Punjab.
What advice would you give to students who want to pursue their career in medical?
I'll answer this question according to one of the questions you asked. Is radiology an easy subject? No, it is not easy. People who are coming up in radiology, they should not think and come that it's a easy branch, or it's just like you have to sit. It's a white collar job. It's nothing like that. You have to work hard, because all the treatment depends upon the diagnosis. If you are diagnosing it correct, the treatment will be better. So it is not an easy job. And other thing I'll want to say is, these days the radiologists are moving away from ultrasounds. They're more into axial cross section imaging, more into CTs. But I'll say, don't forget the roots. Ultrasounds are the basics.
Thank you for your time, sir.
Thank you.
Very honored to have you here.
Thank you.